Hi, my name is Jerry, and I'll be the student nurse practitioner caring for you today. Could you tell me your name?
My name is Gloria McQueen.
Okay, Miss McQueen, it's nice to meet you. Could you tell me a little about yourself?
I have 2 grown children, 4 grands. I'm 54 years old. I've never been married. But I'm looking forward to turning 55, coming this year in November. I have a birthday. And I'm looking for many more.
Okay, well, that's great, Miss McQueen. So just tell me, what concerns bring you in today?
Well, I have a bad cold and cough and fever and coughing up green stuff, and I just don't feel good today.
Okay. So you say you have been coughing up some green stuff, right?
Yes, ma'am.
Okay. And do you feel any kind of congestion with that?
Yes, congestion. That's it.
Okay, and how bad is it?
Sometimes I can't hardly breathe. It's terrible. That's why I came on in to get you.
Okay. So just tell me, when did this start?
About 2 weeks ago.
So it started about 2 weeks ago. Okay. And are you coughing pretty much? How long does it last when you cough? Have it been consistent or off and on throughout that time?
Well, it's been consistent, and the stuff keep coming up, and I thought it was best I come on in and get checked.
Okay. So have you been around anybody who possibly had a cold, or do you remember, or what do you think may have caused this cold?
I think it's just that by going out with my hair wet and taking a shower and wearing not enough clothes, and in the morning time when I be out and about.
Okay. Is there anything that makes it worse?
Well, let me see. It's when I smoke, because I'm a smoker, when I smoke.
Okay, all right. Well, is there anything that makes it better? Have you tried any type of medication over the counter?
No, I don't try over-the-counter medication because I'm a mental patient, and I take side drugs, and I don't try medication over the counter that much.
Okay. Have you tried any kind of home remedies or anything like that to try and help with this congestion? Have you did anything else to help?
No home remedy, because I don't believe in home remedies and what people say they do for cold. But I have sucked a lemon, but that don't help. I had a little lemon juice.
Okay. And have you noticed anything else that accompanies this congestion and everything that you have? Have you noticed any kind of redness in your eyes or any pressure around your eyes? Like any other problems that, you think is going on because of this cold?
Yeah, my eyes be weary and red and sweating and puff in the morning, and my mouth puffy, and my tongue clings to my mouth a little bit.
Okay. Well, how about your ears and hearing? Is any kind of stuffiness in your ears?
Yeah, I can hardly hear sometimes. It feel like they be closing.
Okay.
Mm-hmm.
All right. And you say this been going on for almost 2 weeks, so, it sounds like it's a lot of sinus. Do you have any kind of sinus problems?
I really don't know. I never been checked for that.
Okay. And you say you've been coughing up some green things, some green phlegm. So, how has this affected you at all?
Well, I just got studying, and I said, I thought, and I said, I got to take myself to a doctor and get some help, because I don't want to get to nobody, and I just need me some help.
Okay.
I just need me some help.
Okay, all right. Well, Miss McQueen, now I'd like to ask you some questions about your past history. And I just want to let you know there's a lot of questions that I need to ask you, so it may take a little time. But I assure you that these questions is important because it's going to kind of help me plan the right care to take care of you, okay? Is that okay with you?
Yes, it is.
Okay. So, Miss McQueen, are you currently taking any medications?
I remember my mental health medicine, my psych drugs.
Okay. Did you bring all those medicines in with you?
Yes, it is.
Okay. Do you mind if I take a look at those medicines?
No, go right ahead.
All right. Well, I want you to also tell me, can you tell me the names of all your medications?
Well,
And
I take lithium.
okay. Do you know the milligrams of your lithium?
300 milligrams.
And how often do you take that?
I take one twice in the morning and twice at night.
Okay. And what else do you take?
I take, help me out.
You taking, well, let me look. Depakote? I see here.
Depakote.
Okay. All right. And I also see here that you're taking lisinopril. And you must be taking that for high blood pressure.
Yes.
Okay. And I also see you taking Atlantis insulin. And you also taking metformin.
Yes.
Okay. All right. Well, just leave these medicines to the side because I like to write down your exact dosages to make sure we have that on file. So I'm just going to let those sit right here for a minute, okay? All right. So, Miss McQueen, are you allergic to anything?
No, I'm not. I can take vitamin medicine. It's so happy. I don't be allergic to nothing.
Okay. Any kind of food allergies?
So I eat about everything.
All right. And I did hear you tell me that you do smoke. How long have you been smoking?
Ever since I was 13 years old. And I'm 54 now.
Okay. About how much do you smoke?
I smoke a pack a day.
All right. You've been smoking a pack a day pretty much ever since you was, 13 years old?
Yes, I have.
Okay. Have you ever tried to quit smoking?
I tried off and on with that nigga red gun, but I went right back because there were people around me smoking, always giving me cigarettes, so I just went right back smoking. I can get off cigarettes and run right back to them.
Okay. What's the longest time you think you have quit smoking? For how long? What's the longest time you think?
About 3 weeks.
Oh, about 3 weeks. Okay.
Not that long.
All right.
Those cigarettes happen.
Okay. You got any desire to stop smoking again and try to quit again?
No, I just enjoy smoking, I just enjoy smoking.
All right. Well, tell me, do you drink any alcohol?
No, I don't drink.
Okay. Any illegal drugs? Marijuana, cocaine?
No, I don't do no street drugs, none but my side drugs.
Okay. Well, Miss McQueen, now I'd like to just ask you about your past history. And this about childhood illnesses. Have you ever had measles as a child?
No, I never had the measles. I always had a shot. My mama took us to the clinic.
Okay. How about rubella or mumps?
No, I never had that. My brothers and sisters had it, but I never had it.
Okay. Whooping cough?
No.
Chicken pox?
No, I never had no childhood illness too much.
Okay. All right. Any chronic childhood problems?
Nothing but my mental illnesses. That started when I was in my teens.
All right. Okay. Well, now we're finna talk about your adult illnesses then. So you did tell me that you do have a mental illness.
Yes, I do.
Okay. And that mental illness started when you was 13 years old?
Yes.
Okay. So tell me, are you currently seeing a counselor or a psychotherapist?
Yes, I am.
Okay, and how often do you see your counselor or psychotherapist?
Well, Medicaid on December once a month.
Mm-hmm.
Yes, once a month.
Okay, so you do follow up on a regular basis monthly?
Yeah, and we have a social worker come out here and see us once a month.
Okay. Okay, Miss McQueen. Well, have you ever been hospitalized for your mental problem?
Yeah, about all my life. All my life I've been in the mental hospitals in and out.
Okay.
So many times.
All right. Well, over the past 2 weeks, have you felt down or depressed or hopeless?
Yeah, I felt hopeless till I got my new boots.
Okay. Well, that's good. That's good then. So, how did that make you feel? How do you feel about that?
I feel pretty good, like Christmas coming in.
Well, that's good. That's good. Well, over the past 2 weeks, have you felt a little interest or pleasure in doing things?
No, I feel real empty. I feel real empty and tired and fatigued. Didn't want to do nothing but sit and watch television. But I'm feeling better now, thank God. This week I have to leave them and pick up and do something.
Okay, well, that sounds good. Have you ever thought about hurting yourself or ending your life?
No, I don't know about hurting myself. I know God don't want that. I believe in God. I straight believe in God Almighty, my Creator.
Okay.
I know He don't want that. I'm not going to do that.
Okay. Well, let me ask you about your medical illnesses. What I see that you are taking metformin and Lantus, so you must be a diabetic.
Yes, I am.
Okay. How long have you been a diabetic?
I've been a diabetic for about years. It's been 3 years, but I wasn't taking medicine to just this year.
Okay. So you just started taking medicine for your diabetes this year?
Yeah.
Okay. Do you check your blood sugars?
Yes, I do.
Okay, good. When was the last time you checked your blood sugar?
Yesterday. I tell you, my mental illness been feeling bad, so I just don't check it. I just been feeling like throwing everything away. So I just didn't feel like taking my blood sugar, but I didn't check my blood sugar this morning. I didn't check it on yesterday.
Okay, well, it's important to check your blood sugar. And it's good to check it in the morning time when you first wake up and get that fasting blood sugar. So you can write that down and you keep a record of that. So the doctor will be able to, let you know how your diabetes, whether it's running at a normal level for you where it needs to be, or whether it's too high or too low, or you need adjustments, in your treatment. Okay, and so you do have a glucometer, and you are, basically you okay with checking your blood sugar. You have any problems
with checking
it?
I know how.
Okay, well, good. Also, I see here that you have high blood pressure, too, because you're taking lisinopril for that. Do you check your own blood pressures?
No, I don't have a blood pressure cup, but I'm asking my doctors for one when I go back.
Okay, all right. Do you have asthma, history of asthma?
No, they said I had COPD or bronchitis because I couldn't hardly breathe, but I didn't check back up with it. So I really don't know, but I have something in my lungs because I smoke, But I really didn't check back up with the doctor on it.
Okay, so the doctor did say you have COPD.
Yeah.
Okay, did they ever give you any inhalers before?
They gave me an inhaler, but I didn't use it.
Okay, do you have your inhaler at home? Do you have one that you use at times, or you just you just don't use it?
I don't use it.
Okay. How about, do you have a history of hepatitis?
No, I don't. I never had that. I don't know what that is. I never had no hepatitis. I heard about it, but I never had that.
Okay. HIV.
I don't have no AIDS.
Okay. Now let me ask you about your surgeries. Have you ever had any surgeries?
I had a tubulation when I was 20 years old, but I don't know the surgery I ever had.
Okay. Do you get regular pap smears?
Yes, I do. I get regular pap smears.
Okay. Do you still get your period?
No, I don't get a period. I started getting a period when I was 40 years old.
Okay. All right. Well, let me ask you also, about your immunizations. Do you get the flu or pneumonia vaccination?
I never got them. I don't like them, but I'm starting getting them because I heard that it's best to get one.
Okay. Also, have you ever had like your childhood immunizations? Are you current on that? Do you remember getting like a tetanus, diphtheria, and all those childhood immunizations when you was a child?
Yes, I got all of them.
Okay. Well, are you current on your tetanus shot? Have you had a tetanus shot before?
Yeah, I have one.
Okay. How about TB skin tests?
I had TB skin tests. Yes, I had them.
And when was the last time you had a TB skin test done?
I had one recently when I was in the hospital in Birmingham. It been about 1 month ago when I got out.
Okay. Now, now I forgot to ask you, when was the last time you had your tetanus shot?
That was when I was in the hospital in Birmingham. They gave me a tetanus shot.
Okay. And when was the last time you had your pap smear done?
Pap was done last year. Last year around about April.
Okay. How about mammogram?
I got that done the same time.
Okay. Have you ever had your stool tested for blood to see whether you had any blood in your stool?
No, I never had that test. I don't remember that.
Okay.
I don't know put no stool. Nobody test no stool.
Okay. Well, how about a colonoscopy?
I never had that.
Okay. When I see you are, you say you're 54 years old, right? Okay. Well, a colonoscopy is something good for you to have right now at this time, because when you're in your 50s, they would like for you to have this routine screening done, because at that age, you're at higher risk to develop colon cancer. So if you go in and get this test done, they can take a look inside your colon, see whether or not you have any kind of tumors or any ulcers or anything that could be cancerous. And if it is something, that they see, they can go ahead and remove that, or, basically this is just a test to determine if anything is going on. So it's something, that is good for you to have.
Test, where you go to have it?
Okay, we're going to talk about that in just a little bit, when I finish getting the rest of your information.
Okay.
And we will discuss that. How about cholesterol? Have you ever had a cholesterol test done?
No.
Okay. All right. Well, Miss McQueen, now I want to ask you a little about your family history. Okay. Have anyone in your family ever had high blood pressure?
Yes, I believe I had a couple of my sisters and brothers had high blood pressure.
So both your sister and your brother?
Yeah.
Okay. And are your sister and brother still living?
Sister and brother did.
How old was your brother when he died?
He was about in his 60s.
Okay. How about diabetes? Anybody in your family ever had diabetes?
Yes, several of us had diabetes, and I got it too. Several of us had diabetes.
So you got several different siblings?
They had diabetes, yeah.
Okay. So how about any thyroid disease or renal disease you know of?
No, I don't know about no thyroid or renal disease. I none of them on that.
Okay. How about coronary artery disease? Something wrong with the arteries in your heart?
No, we don't have nothing wrong with our arteries in our heart.
Okay. Arthritis?
Oh, no. Then too many have arthritis, but you got it now.
Okay. A few of your brothers and sisters do have arthritis? Okay, Miss McQueen. Anybody in your family ever had seizures?
Jesus. No.
Okay. How about mental illness?
Yeah, Dad had it.
Your dad had mental illness. Okay, is your dad still living?
No, he did.
And when did he die?
I don't know.
Okay. All right. Well, anybody in your family had any substance abuse?
Substance abuse?
Like anybody in your family do your drugs and...
Yeah, we all did back then. We were young. Travis was young.
Okay. Any other allergies in your family that you know of? Any with medication allergies?
No, No.
Okay. Any history of cancer?
No.
Breast or colon cancer?
No.
Okay. Well, I'm going to ask you a little bit here about your personal history, okay? Miss McQueen, when was the last time you had intimate or physical contact with someone?
Oh, been a long while now. It's about a month.
Okay. Did that contact include sexual intercourse?
No, it wasn't sexual intercourse.
Okay. Do you have sex with men, women, or both?
Men.
Okay, this is something that we just have to ask, just routine questions.
Okay,
Miss McQueen. Yes, ma'am. Okay.
But y'all are rough.
How many sexual partners have you had in the last 6 months?
I had 4.
Okay. Do you remember in the last 5 years?
I've been that many.
Okay. Do you always use condoms?
Yes.
Okay. Do you have any concerns about HIV infection or AIDS?
Yeah, I have concerns about it. I'll be careful. I'm thinking about it. I don't want to get AIDS.
Okay. Have you ever had an STD?
What?
Sexually transmitted disease? Yes, ma'am.
I never had a sexually transmitted disease.
Okay. Do you know when the last time you was tested for that?
Oh, I've been tested.
Did you test for that problem? You had your pap smear done? Do you remember if they test you for any STDs, sexually transmitted diseases? Okay. All right. So, Miss McQueen, when you're having problems, how do you cope with your problems?
I can't do nothing but lay down. I don't go nowhere about to think about them.
Okay, well, that seems to trouble you. Can you tell me a little bit more about that?
I'm depressed. I don't go nowhere. I'm depressed. I don't have no money. I don't have no car. I'm just down and out.
Okay, and how long have you been feeling depressed?
I've been feeling depressed for a long time because I know it's true.
Okay.
Just down and out.
Have you did anything to kind of help with your depression? Do you feel this way all the time, or do you have some better days sometimes?
I have a good day. I'm just going to go ahead and take my bath and look to the hills.
Okay. So, Miss McQueen, do you work anywhere?
No, I don't work nowhere.
Okay. Do you do any type of volunteer activities or anything like that?
I ain't volunteering nowhere. I got to know how to roof over my head, what I'm volunteer for.
Okay.
And I don't go to sleep.
And Miss McQueen, what religion are you?
I ain't no religion.
Okay. Well, just tell me a little about what your normal day is like. Your activities of daily living. What you normally do on a regular day.
Clean up, take a bath, lay down, and go to sleep.
Okay. And tell me a little about your diet. What do you normally eat?
Well, I eat fried chicken, baked chicken, salmon and stuff. They just told me to give me some microwave food. That's that little dollar microwave food they came for $1, then to start packing them up in the fridge. They start using the microwave. And then I had to lose weight. I'm too big. I think I'll try that next time. Change my diet because I have been eating like a horse.
Okay, and so you say you are overweight. And have you been trying to do any exercising? Do you do any exercises?
Well, I walk, but that don't help. You're overweight.
Okay, well, your diet, I see a lot of things that you was telling me you eat. A lot of those things are high in carbohydrates and fats, and sugars. So, cutting back on a lot of that and incorporate more lean meats and green foods and vegetables, that would help, with your weight. Trying to, have you ever tried to put yourself on a diet and stick consistent to it?
I ain't worried about it. I'll give me some of that diet food.
Okay, well, that's something we can also talk about a good diet plan for you. And that's something that we can, follow up with you on a diet plan and try and teach you about different foods that you can eat. And you say you do like to walk, so along with changing up your diet and continue walking, of course it's going to take some time, but you will, hopefully you'll see some results with that.
Okay.
All right. Do you drink any coffee, tea, or caffeinated beverages?
I love coffee. I drink coffee all day long.
Okay. So, as far as safety measures, do you use any seat belts when you're riding in the car?
Yes, I do.
Okay. Do you have any smoke detectors in your home?
Uh-huh.
Okay. Is there any other questions or anything that you'd like to ask me that we haven't actually reviewed or went over?
I just asked you about my car. We get to that matter, and you can help me get my dad, and then we could get along just fine.
Okay. Well, that sounds good to me, Miss McQueen, and I really appreciate you being patient with me and going over these questions. Like I said, I know it's a lot, and I really do appreciate your patience. But I'm going to look over all the information that I have, and we're going to see how we can take care of you, okay?
Okay.
All right. Thank you, Miss McQueen.
Thank you.